Hello and welcome to the Posture Dojo podcast. My name is Sam Miller and I'm your host, guiding you on a postural transformation journey, sharing stories from my own healing journey of an 85-degree kyphoscoliosis and speaking with experts from a variety of fields, some you might expect and some that you might be surprised by, from breathwork to movement to gymnastics to mindset, everything that embodies a path towards our highest and healthiest selves. Today, I'm excited to be talking to Lillian Holm on the podcast, who's a physical therapist and a fellow guide of health and wellness. And I'm keen to dive into a couple different topics today with Lillian. First of all, introduce yourself. Where did you come from to end up where you are now?
So thank you for having me here. I look forward to the conversation as well. It's a topic that I'm quite interested in, have been long before I became a physical therapist 30 years ago. I did that originally in Sweden and swiftly came here, recruited to the United States, and I've been here ever since and worked in the corporate system, if you will, in various clinics. Did not find that conducive to practicing in a way that was ideal for my patients. So about 15 years ago or so, I opened my own private practice, and that's where I am. And that is in Evanston, Illinois. And my practice primarily, almost 100% at this time, centers around the treatment of individuals with hypermobility disorders.
And how did you end up in that specialization?
In the same way that a lot of other therapists who specialize in that field, I became aware that some of the issues with my own body derived their roots in hypermobility, and was then further down the road formally diagnosed with what's called Ehlers-Danlos Syndrome, which is a disorder where the connective tissues of the body are a little, shall we say, softer, and then that can have repercussions throughout the body and the musculoskeletal system, but also in other systems of the body. It's a fascinating patient group to work with because a lot of these issues that affect all of us, the entire population, can be a bit more clear and affect that population more.
And what is this condition like for someone living with hypermobility?
It can be completely asymptomatic. We have a lot of high-performing athletes, musicians, performing artists that benefit from their hypermobility. A swimmer, for example, might be faster because their shoulder joints move better than the average person. But a very large percentage of people with this sort of do suffer from musculoskeletal pain due to the instability, and including the postural challenges that it creates. It can contribute to anxiety and depression. It can contribute to gastrointestinal dysfunction and affect the person's life quite broadly, including the nervous system.
Amazing. So we seem to have a lot of overlap with a lot of different parts of the body being affected, and a holistic approach to creating wellness in that kind of situation. I've noticed that you're very specific, careful, and precise with your words. Instead of saying problems, you'll say issues. And we just briefly touched on, before the podcast, talking about posture itself. And is posture even the goal? What's your perspective around that, about how we approach talking about posture and giving someone a North Star to improve on that, considering many people in different situations have some type of compromised posture? That's the words that I would use to describe the people dealing with a scoliotic curve or a kyphotic curve or some blend of the two, lordosis, other types of abnormal spinal curvatures that may be compromising their most ideal, effortless posture. Is that an accurate way to describe what's happening, and how do you perceive it?
Yeah, I like the words you chose as well, and you're right, I am careful with language. I think it's in and of itself already an imperfect tool for communication, so we don't want to muddy the waters further by being sloppy with language. Often, posture, at least spontaneously when I'm interacting with patients, is referred to as good or bad, and that is definitely a way of approaching it that I want to get away from. We don't benefit in any way from adding a value judgment to it. At the most, we could say that there might be postural alternatives that might be bad for you in some way, fatigue you or contribute to pain or decrease function, and postural strategies that might be better for you. But we do need to define words in order to be able to use them. So when I use the word posture, I would both refer to our need to hold ourselves up against the gravity of planet Earth. So that is part of our postural effort throughout the day. And there we sort of rely on our skeletal structures and then derive support from both active structures like muscles and passive structures like joint capsules and ligaments and that sort of thing. But we also say someone's posturing or expressing themselves with their body, both consciously and unconsciously. And any actor would know that they would use not just their lines, but they would use their body language to express the inner life of their character. And that's what we do all day long. And we all have a fairly easy time of deciphering someone's mood and energy and attitude from what they're doing with their bodies. And of course, there's a lot of research showing that's a bidirectional thing. What we do with our bodies, how we position them in three-dimensional space also affects our ability to perform on tasks, our sense of self, and many other things.
Absolutely. The way we posture can trigger the releasing of certain chemicals that will affect our mood, perhaps. So if we stand in a power pose, we'll feel more powerful. If we collapse and slump and get into a depressed kind of hunch, we can feel that as well in the body. The brain will start responding, I guess, where things aren't good. So let's adapt to that situation from there. I guess the challenge on social media is that the words that people are using is, I need to fix my posture, is kind of where sometimes as someone who's offering a service or offering a solution to postural issues, there's a line that you kind of have to balance between speaking in their language and speaking in the way that would be a better way to approach it. So how are you currently approaching talking about it on social media? And perhaps share some, let's be clear and say, what phrases out there are you not a fan of right now?
I would not agree with any perspective that tries to completely trivialize the effect of human posture on function or emotional well-being or anything like that. And I think a lot of those perspectives really stem from a starting point where posture is perceived as a static point in space, that we all need to get our head just there, and then we need to get our pelvis just there, etc. And we have genetic differences across the world in terms of the position of the pelvis, especially the sacrum. People's feet look very different in different parts of the world, etc. So it's clear that there's not some sort of universal mold that we are trying to fit ourselves into. But just because that isn't true, you don't want to throw out the baby with the bathwater and say that posture doesn't matter at all. And a popular phrase I've come across many times, even in professional circles, is the claim that the best posture is simply just the next posture. And when I see a patient that's cycling through postures very quickly, if they're standing up in front of me for an evaluation and they're just like constantly moving, that is a symptom. That's a negative symptom of someone who has what you called, broadly speaking, a postural compromise, clearly does not have a good program in their motor program, their movement software, for how to hold themselves up, and are relying on very subpar strategies that evolution did not really design for us.
So perhaps someone's going throughout their day, their mind is in other places, and they realize they might not be holding themselves in the most optimal way. Is there a default program that you like to instill, or what is your North Star that you're giving to people that you work with when it comes to this?
I would say that my North Star, if you could call it that, is, among other things, a very, what we could call an evolutionary perspective. I like to look at whether it's the human being or other animals. I like to understand our function from the starting point of what did we evolve for? What was this intended for? And it's broadly agreed that there is a mismatch currently between what our bodies evolved for and the lifestyle that we've created for ourselves. And if that sounds odd to someone, then just think about the fact that we do something as weird as exercise. I just this morning sat on a bike that didn't go anywhere, and then I picked up heavy weights off the floor and just put them back down again, and I did it over and over again. My grandfather would have thought that's nuts, but we're having to do that because we no longer have the strains on the body in our lives that we need. And in the same way as we understand that our and strength, broadly speaking, suffer from this evolutionary mismatch, we need to understand that it's affecting what we call posture as well. And I started thinking about this very early on in my very early 20s. I was a bit of a nomad, and really all I wanted to do was travel the world. And the more exotic the locale, the more fun it was. And one of the places that took me to, that I remember vividly, was West Africa. And I was not even near being a physical therapist at the time, had no such thoughts. And yet, the moment I landed at the airport, all I could think about was how people held themselves up, their posture. Young and old, little, small and large, fat and skinny, doesn't matter. Everyone moved in a way that was very erect, yet very relaxed. A lot of sort of soft movement, effortless. It looked confident. It looked like it would not be expanding a lot of energy. It just looked wonderful. It was beautiful. And then I saw how people moved, not just how they held themselves up, but they would move in ways that were, I realized later when I was professionally able to analyze it in my mind, so ergonomically sound. And because of that, they were able to perform physical feats that would seem like a very hard workout for someone in a more industrialized country. So that picture is etched in my mind. And while I haven't, for example, been to the Amazon rainforest region, I've seen videos from there, and there are huge similarities, such as, for example, maintaining an erectness of the spine instead of collapsing and moving from the spine, using the biggest joints of the body to, for example, bend forward, that sort of thing. You see this universally throughout the world. Squatting, getting down to the ground that way, all of these are universals. And you do not see those in our society. And we suffer from having changed the way we move.
Is integrating some of those ways of life and, I guess, movement opportunities part of what you do now? And have you had interactions with people with the scoliosis and kyphosis, and then how do you approach applying these types of things that you've been observing?
So with any patient, what I work on with them doesn't have a diagnostic label as a starting point. It's, of course, a very helpful tool, a shorthand for communication. But just because you have a scoliosis, you're not like the next person with a scoliosis. So what the therapeutic journey ends up looking is very individualized. It really depends on what is going on with that person, what their challenges are, what is going on other than that there is a scoliosis. And of course, a scoliosis looks very different in different people. When I see someone who's still growing, then I'm often very hopeful that correcting any rotations around the pelvic bones, and again, remember that I primarily see hypermobile people and we are more prone to that, then I'm hopeful that will help prevent an already developing scoliosis. And I've seen that happen when I've been able to follow a young person through their growth spurt past puberty. If we imagine the pelvis as a flower pot, spine as the stalk of the flower, wherever the pelvis points, that's where the stalk, the flower, will point. And then, just like a flower, our body seeks to arrange itself over a base of support. So then there will be a corresponding curvature. So if we can meet a person at a stage in their life where we can arrange the flower pot in a balanced way, then we can prevent the body having to go through the compensation higher up. But in an adult, of course, where the growth spurt is over and the body has sort of solidified in a certain way, then the goals are a little different.
One of the biggest challenges for me on a mission to help people on the strengthening and the lifestyle, the quality of life, the pain-free and powerful postures that aren't as compromised, people who are dealing with compromises. And I'd like to I'm playing with the wording here and being as careful as I can, because I also don't want to label someone, oh, you have scoliosis, you have kyphosis. I mean, you have a spine, and there's a compromise there. It's going on, but the label is not always helpful, I find. So I'm curious how you approach that, and then from that place, how you're helping them, because in person, there's a lot that can be done. And it sounds like you have a lot in person, but I think you have some online offerings as well. Yeah, so one of the biggest challenges for those tens of millions of people who are dealing with pretty severe spinal compromises, structural compromises, not all of them are going to probably have the chance or the budget to work with someone one-on-one. What is their best hope? The people who are starting from a place where they might not have physical access, but they obviously need to get started as soon as possible. What does somebody like that need to start kind of putting into action in their lives?
Yeah, that the access to proper care can often be such a difficult issue for a lot of people. If at all possible, I would seek out a person, even if that would involve travel or contacting with them online or what have you, for at least sort of like a basic assessment to learn about my challenges. What is it that's going on? Because the way I like to look at it is not from the negative doom and gloom perspective. If you do this, you're going to be at risk for this is going to happen. But rather looking at opportunities, just like anything else in life. Let's say you're asleep, right? Should we teach people that if you don't get good sleep, your risk for cancer increases? Maybe, that's true, but I think we need to instead, or at least include, saying, if you expose yourself to bright light in the morning and shield yourself from light at night, you will sleep better. So we're looking for opportunities. And when we look at someone whose body has adapted to a compromised skeletal structure, for example, then one of the things that, given gravity, that we're at risk for is that increasing over time. So if we can look at the main factors where the body is going in the wrong direction and set up a program where the individual knows that I need to maintain these few areas, and at least then I'm going to stay exactly where I am, then it's a positive message. It's an opportunity that we can grab, something we get to do as opposed to a chore that we need to do. So if I don't want to name specific muscles and go into that sort of detail, but what you would find in any given person is that something is really tightening up, something is compensating for something else. And if we can just nudge that in a better direction, then the first goal that most have is, of course, pain relief. But the pain relief is not something we do in isolation. That comes out of improving the function.
Because often, at least in postural compromises, is the pain, and especially in my case, during those teenage years when the compensations of my musculoskeletal structure were bracing itself, the pain was coming from that chronic tension, that chronic bracing that was happening internally for many years. And especially when I was in certain positions, it just was just something I learned to block out and ignore, because I didn't have the strategy, the postural strategy to kind of approach that. And so, yeah, addressing the pain that's a byproduct of kind of addressing the structure. I consider it as a kind of a red alert in the body. Listen, there's been a compromise, there's compensations happening, let's understand where those are, and let's start activating the parts of the body that may not have been activated, that need extra activation right now.
Yeah, that's such an important point, because when we find ourselves in a bad situation where function has suffered or we have pain or whatever, and then we have the diagnostic label of, say, scoliosis, for example, or hypermobility or what have you, it's very easy for the person themselves to interpret that as my scoliosis is causing this. That's not true. There's something in between. There's something that was a predisposition to go in the wrong direction that sort of maybe even forced the body to rely on compensatory movement patterns. But it's when we go deeper and deeper into those that the pain happens, that the decreased function happens. And that's what's causing the pain, not the scoliosis itself directly or another diagnostic label directly. So that means that even if you maintain that label your whole life, that's your diagnosis, how you feel, that's where you have a lot of leeway. And to your point about tensing up, that is a common issue among all sorts of populations. Even with the very common low back pain, it's been shown that when you have acute low back pain for just a week or two, that's enough of posturing in a new way, holding yourself stiffly, moving stiffly, to rewrite the movement software in the brain. And now, certain deep stabilizers in your low back have actually shrunken if you look at them with an MRI or an ultrasound. And now, you don't notice, you don't feel it, but now you are instead using more superficial muscles. And they are more meant for movement, not for postural stability and postural work. And now they will produce pain as a result of having been put into this job that they're not designed to perform. So if we understand that, for example, is the cause of my pain in that area, now I have the chance to reverse that and get back to as close as possible to the natural functioning and have less pain and better function.
These muscles to work, in my understanding, is the nervous system. The noodle that extends out from our brain stem through the middle of our spinal column, through the middle of our vertebrae, and filters throughout our entire body and channels information in both directions, receiving the sensory input from the eyes and the ears and the mouth and the visual processing of the environment, as well as our skin, and then sending that information down and receiving. It's a two-way communication system going on. And if we have a compensation, parts of the system are automatic. Parts of the system we can say open hand, close hand. We can send instructions, but part of it's automatic. And when we have these types of compensations, it seems that can be what's happening. Added on that, with scoliosis, there's recent studies in the last 15 years that's still taken time to kind of get fully integrated into how the system approaches these types of issues, is they've discovered that spinal cords are contracted. They're shorter in adolescent idiopathic scoliosis patients, people who have undiagnosed scoliosis essentially. So they've identified a contracted nervous system, contracted spinal cord inside of people with scoliotic curves in the spine. To me, I'm optimistic that more treatments are integrating this, because that's essentially a psychosomatic approach to the situation, psycho being the brain, psyche being the brain, and then the somatic being the body, whereas traditionally it's really been bracing and surgery is how they approach these types of issues. With that understanding that our nervous system is potentially in some contracted form, and especially during those rapid growth years where your spinal column is growing at maybe a disproportional pace, you've got a contracted spinal cord, and then you start seeing this warping that happens. And in that warping, you've also got a compensation of chronic tensions, which are also happening through the nervous system in a more automatic way, where your body is kind of bracing and kind of creating tension in these places and forming a kind of compensatory posture. So to me, the nervous system is the key and the path for us to unravel this whole compromise. And the bridge from our thoughts, our awareness, our consciousness, our understanding that the nervous system is the path, is the breath. I feel like the breath is something that we can tap into to start regulating the nervous system, combined with some of these more physical movements. At least that's where my approach to what I do in my own body and what I'm doing with the people I work with. I'm curious how you approach the nervous system in your work and how you're engaging with it to promote being.
You're touching on a very important aspect of being human there, of course. And the nervous system that we're talking about here is more the autonomic nervous system. You mentioned we have volitional movement, but not what we're talking about when something's happening without our intention. So what we're talking about then is the autonomic nervous system. And the main two channels of that, the two modes, would be sympathetic nervous system mode, which would be the fight or flight, and parasympathetic nervous system mode, which is the rest and digest, etc. And we could also be in sort of a freeze response, but that gets a little more complicated there. So broadly, we could look at the SNS and the PNS, the parasympathetic and the sympathetic. And we are really intended, like other animals, to be in the parasympathetic nervous system mode at most times. That's where we learn, grow, feel safe, interact with other people peacefully, digest, just live the way we're intended to live. And then we're supposed to slip into sympathetic nervous system mode, just for brief moments, usually in a moment of danger or stress. Sort of the archetypal run away from the tiger or tiger catches up with you, but in either case, it's a brief moment. And going back to that mismatch that I mentioned earlier, where we actually find ourselves now, already as a society, is in a lifestyle that pushes us towards fight or flight all day long. And that is a very wearying way to live. And many additional challenges, such as in my case, the hypermobility disorders that I deal with, tend to push a person more into that fight or flight even more. And when we stay there for a long enough period of time, it starts to feel like normal, and we don't really even notice how much we are in that state, how much our whole life is burning the candle at both ends. So the breath is one of the very powerful portals to calming down the nervous system and switching it back into the parasympathetic nervous system mode. And an important part of that is the vagus nerve that is very active during parasympathetic mode and really innervates everything from the diaphragm up and from the diaphragm down. So all of those peaceful functions. And when we take a deep breath, we are activating, we need the vagus nerve for that. My son once made a very good point. He said the brain is sitting here in a dark room and it can't see anything. So it relies completely on information from the outside, on messaging that we receive. And that messaging can even include, again, what we're doing habitually or for good reason with our bodies. So it's always a bi-directional relationship. So what I often start with therapeutically with patients is whatever seems appropriate in the moment to just calm the nervous system down and switch into parasympathetic mode, usually lying down on the floor, using the floor to create a sense of where the body even is in space, doing techniques to activate the vagus nerve, doing some slow, deep breathing, and gradually practicing that more and more. Because as long as we're stuck in fight or flight, we're also stuck in muscle tension and bracing. And that is not the same as deep stability from the inside.
This is an area that I'm dedicating a lot of time in, as well as creating in my own protocol the types of exercises that are essentially finding this little sweet spot. Because the mistake that I made with a very severe kyphos going into the gym, I was going to the gym like everyone else. I was going in quite aggressively, quite hard. I thought fight progressive overload and lift as heavy as possible. And I kind of cemented in a lot of tensions in that time, a lot of compensations in that time, because I had this compensated structure of strength in my body, and I was in my sympathetic nervous system. I was using and reinforcing compensating strength. So not a pretty picture, and it's taken years for me to kind of unravel that. And so the path that I'm currently now on is going into the gym, connecting with the breath, keeping that activating the parasympathetic, maintaining that relaxed state, whilst going into some of these strength building positions, which might be a plank, it might be certain types of traction, and then with my breath integrating methods like the Schroth rotational angular breathing, which requires to be in parasympathetic, that relaxed state, because when you're in that state, you're releasing the tensions and you're allowing that elongation and that alignment to happen. And with those inhales and exhales, I'm then reprogramming new emotions. I'm reprogramming trust. Sometimes it's safety, confidence, protection. I'm exploring different words and emotions to re-educate those positions once I've aligned and created that elongation and alignment. And so that's very, very different way to approach the gym nowadays, but I'm trying to integrate as much of this as possible into this, because it's the path. When you look at how the body is structuring itself, these are the things you have to understand to do exercises that are building your body in a healthier way, instead of building a body that might be holding a lot of unhealthy or things that obstruct your flow.
Quite fond of encouraging people to not start where they want to end up, but start where they are. So we kind of have to have awareness and humility enough to realize where we are. And if we are entering into whatever process it is that we're using because of long-standing pain and dysfunction, what is often going on, whether we realize it or not, is some degree of dissociation and not feeling safe within one's own body, not even feeling like we're friends with our own body. So a very important part of any such process is to decrease that dissociation, become more aware of your interoception, the sense of what's going on inside the body, and the proprioception, the sense of the body's position in space. And when we start to feel like it's safe to inhabit the body, then we also derive so much more information, which sounds like exactly what you've done. You've tuned into your body and started feeling more safe there. And that's given you, it sounds, access to using your body in a very different way. Whereas when we are in a state of fear, which dissociation is, it's a protection from some sort of pain, physical or mental, emotional, then we are basically bracing for impact, right? We're just bracing, which means we're contracting muscles front and back, we're contracting movement muscles, and our stabilizing deeper muscles are just atrophying. And that is a bit of it takes a bit of work to unravel, but that awareness that you're espousing is fantastic.
And I would suggest much of the pain is coming from that chronic, fearful bracing that's happening in the body.
Absolutely.
And before trying to get stronger, before all of these other directions and other North Stars, the unraveling must happen. And I think it is different for each person. But when you're in those situations and you've got certain types of exercises that create elongation and alignment, naturally to do a pull-up, that's your muscles, your weaknesses or any compensations that you have. If you're doing it slowly and you're attempting to stay in form, with your awareness, you'll see what's kind of going on, what's not activating, what's activating. And the way through that may feel like you're just going to push through and just create that strength and push through it. But I would suggest, as you said, removing the ego, removing with humility, going in there and going as slow as you need to. And if it doesn't, the rep doesn't matter. Doing the rep, doing the movement doesn't matter. It's about what you learn along that way that will truly kind of enable you and kind of give you the information, give you the direction, and kind of give you the awareness of the tension. And once you have the awareness of that attention in your mind, I think it's useful to find the opposite of that tension. And if it's fear, then it is some kind of love. That is the answer. Love is the opposite of fear, and it may be more love for yourself. It may be trust. It might be I'm protected. I'm safe. It might be just going through just enough movement as slow as you need to show that, oh wow, you do actually have that range of motion, and observing how your mind and your thoughts of what you're holding in your mind as you're arriving into that tension or that restriction or that obstruction. What thoughts can you carry with you through your body, through your breath? And it's once you have an experience of that, it's profound. You start realizing how empowered you are to start reprogramming your body, truly. Because you'll notice as you change your thought, your physical body, that tension that you thought you had there, that chronic pain, that chronic obstruction that you thought you had, that restriction of movement that you thought you had, with a slight change of your mind, you can make it dissolve and you can make it disappear. And once you have that awareness and that ability, that gives you belief, that gives you empowerment to take that deeper and take that into the parts of the body that need it.
Culturally, we live in a society that basically teaches us to relate to ourselves from the neck up. And you will often hear people talk about, my muscles are tensing up, my leg is doing this. It's as if those from here on down, it's an alien, and we are here. And what you're describing so beautifully is the reintegration of the body and the mind. They were never distinct and separate in the first place, but we can rediscover how integrated they are. And it is a beautiful, enriching experience beyond our physical goals to come out of that dissociation and start to live more as a whole being in connection and contact with the body. And what we realize then is that the body is not the enemy that's just doing things to you, it's you. And your thoughts and intentions and your loving attention has a huge impact. So we are actually not hapless victims of those tight muscles. We are completely in charge of our bodies.
Before you said in charge, I was imagining that torus field, but that's literally the charging of energy is that torus shape. And we are in the center of that because was the mind telling the body or is the body telling the mind? It's this continuous circuit. It is a continuous charge that we are guiding. We can choose to hold on to some thoughts and let go of other thoughts. And those thoughts that we choose to hang on to eventually filter and start embodying. You had mentioned something along that lines, that the way that we feel is the thing in our control. Yeah, you had mentioned earlier that the way that we feel is something that we have an effect on.
Right. What I meant was that our bodies are not just happening to us. Even when it's on levels that we would normally not imagine that we have any volitional control over, like our immune system. But we know that our mental state and our attitude and our beliefs, our feelings of safety or lack thereof, have enormous effects on the immune system, very directly, for example. That reintegration of understanding that it's a bidirectional relationship, and the body affects the mind, affects the body. And even that is a silly way of putting it because they're not two separate entities, but we just experience them differently. And it's a very different experience being alive in this dimension when you have that sense of being the director of your own show. A lot of our experience is on autopilot, and that's a great thing, right? It's energy saving. Our thoughts are on autopilot, our beliefs are on autopilot, our movement patterns are on autopilot. But what we're talking about here, I believe, is that if those beliefs or the movement patterns, whatever it may be, don't serve us well, then we have the opportunity to reprogram them.
Amazing. And if we've had a compromise, whether it's in our structure or maybe a softening of our joints, there are things you can do, there are things that you can direct, and they are very well inside your power. No matter what labels or external kind of ideas are out there, you do have this innate ability to create alignment by allowing and aligning to higher thoughts sometimes. So Lillian, thank you very much for coming on the podcast today. I think we've had a very holistic conversation around renegotiating with gravity. What's your current offerings, and where can people find that if they'd like to work with you?
I'd like to share information that I hope will be helpful to people worldwide on social media. So that's primarily on Instagram and Facebook under the moniker Hypermobility Doctor. And I see patients in person here in Evanston, Illinois, or via telehealth. And then I also offer consultations that are specific to hypermobility conditions for people to learn to understand their situation, their conditions a bit better. And I also offer virtual training, personal training sessions that are specifically geared towards individuals with hypermobility conditions as well.
Perfect. Okay. Thank you very much. The links to get in contact with Lillian you'll find in the show notes below. Lillian, thanks for coming on board, and thanks everyone for listening.
Thanks for having me. It's been a pleasure.